we're going to help you, patient. And now patients are like, wait a second. I think the biggest misconception is that
Welcome, Dr. Tania Elliott, the one of the names that everybody finds the moment they open their Instagram, internet, anything social media. Dr. Tania is there. And you, Dr. Tania, actually really resonate with our podcast, Bridging the Gap. I went through several of your Instagrams and other social media, and I saw that you're bridging the gap between science and sense. So you are the Dr. Breathe Easy of internet. So thank you for joining me today.
thanks so much for having me. I'm excited to be here.
Wonderful. So, Doc, I would like to start with one simple thing. I would like you to take me back to that moment, maybe in high school or college, when you realized you had this unique ability to explain complex scientific concepts to people. Like whenever I watch you, I see that you are bringing very, very complex medical books into one 30-second video.
Gray fuzz in your hairbrush is grosser than you think.
And it just is astounding. What was the first aha moment and what did it make you feel?
So I'll have a little confession here that I was a big time science nerd growing up. And I think it was in middle school, I was doing a science experiment and we were adding different ingredients to soil to see how tomato plants would grow. And so I had one pot of tomatoes and I added coffee grinds, and then another one I had added celery, and another one I had added lettuce, and then I was measuring each day how it was going to grow, and then I had to give this presentation, and I got really great feedback that I was able to explain the scientific method in a way that really resonated with not just the teachers but also the students. And I said, maybe I'm onto something here with my presentations. And then that work, I was doing microbiology research in high school. I was an Intel semifinalist. It used to be called Westinghouse and became Intel. And I was always taking these very complex studies and research and then making them fun and interesting to the audience, where everyone was like, "Ooh, I want to take your biology class." And so, yeah. And then when I was in medical school, I actually did a rotation at a news studio because I thought learning how to do medical journalism would be really interesting. And then when I was in residency, I worked at ABC's medical unit in New York City because I think that skill of translation is really important. And I also think the enthusiasm, bringing the enthusiasm to the learning and the medicine is really important as well.
Beautiful. So you live in New York?
Yes.
And did you go to medical school also in New York?
No, I went to medical school in Philadelphia at Jefferson. And then I came back to New York to do my training at Mount Sinai Medical Center.
Oh, that's a phenomenal place.
Yeah.
That is a phenomenal place. Asking you question number 2, which is you worked in traditional medicine like regular medical doctors do, and then you became a pioneer in telemedicine. And truly in 2020, I am guilty of investing in Teledoc and some of those stocks that went like $300 and then came back to $10. But all the while you were building a huge social media presence. In that process, what was the moment where you felt the most disconnected from your purpose? Like, once you're doing this, you sometimes feel, am I actually taking care of the patient? And what did it take to find your way back?
So I'll tell you what made me feel disconnected from my purpose. So I started off in private practice on Park Avenue, and that was the first time I felt disconnected from my purpose because of all the challenges with traditional healthcare delivery. And that's why I ended up finding telemedicine. And the reason it's relevant for my field as an allergist is I would have patients leave their home environment, and then come to my office and then tell me everything that was in their home environment because I was asking them about what their potential allergic triggers were. And I thought it was incredibly inefficient, especially it wasn't being respectful enough of their time because I'm sitting there asking, well, what's in your living room and what's in your bedroom? And do you have any live plants? And do you have any carpets? And I was like, can I just come over and see into your house, and then I'll be able to make a diagnosis? So that was the first time, and that's what made me go and start to do telehealth. This was in 2013 with a company called Doctor on Demand. And then I was really excited about that work. From really 2014 to 2017, we were the first nationwide group of physicians that were doing video-only visits. So you can enter in your symptoms, click a button, connect with a doctor face-to-face like we're doing now. And that was really innovative, and I felt like I was changing healthcare. I since worked for private equity backed businesses in the employer space, and then in the payer space with CVS Aetna, and then for a very large health system at the height of the pandemic, oversaw 3.5 million virtual visits. And the world came back on after the pandemic, everyone sort of went back to their old ways. And here I was showing a different path of hybrid care where you don't always have to see your doctor in person. And everyone's like, well, we get paid more if patients come into the office. And we got real estate bills to pay. And there were some other challenges, but lo and behold, I became very disconnected from my purpose again because I said, I want to reach people in their homes and I want to empower them with information. I want to help them make healthy lifestyle decisions. I want to be the first face that they see and say, oh, wait, I remember Dr. Tania told me not to do that or to try this, right? And I wasn't getting there by trying to innovate within a broken healthcare system. I tried with the insurance company. I tried with a large health system. I tried everywhere. And I said, you know what? That's it. And so I didn't start doing social media until just 2023. November 2023 was when I first started doing social media. And that's when I got reconnected to my purpose again, because I said, you know what? I'm just going to empower people to stay healthy so that they don't even have to deal with traditional healthcare anymore. And so that's what I've done. And I hope I'm making an impact on people's lives where they're
Oh,
just
you are.
small choices, lifestyle choices, because a lot of people don't realize that the little things they're doing are impacting their health in a negative way.
So I'll tell you one of my instances, and I'm sorry to deflect. Actually, I watched one of your videos yesterday, and it was about the eye drops that you were saying, do this and don't do this. And I took a screenshot of that green bottle. I was finding that on Amazon to make sure that I buy the one that you recommended. So you did influence me right away. And then I was looking at your little receipt.
Don't touch this.
And I was trying to make sure that next time I'm not touching that BPA.
Most receipts use thermal paper containing bisphenols or BPA.
That
Well,
receipt is going to
now
transfer.
my kids are like, Mommy, don't touch that. I'm like, well, once in a while, I got to touch it and throw it in the garbage. But because otherwise I'm leaving it for the person that's working there and they're touching way more BPA than I am.
Amazing. But the simple things that you are teaching, unbelievable. What is the biggest, most dangerous misconception you see in public, whether it is about allergies or more broadly about our modern healthcare systems? What's the simple truth people are missing? Because our system is getting too complicated, insurances are getting too complicated, and people are losing trust in medicine. So, what do you think about that?
I think it's really tough right now. I think where we are is the consumer truly driving healthcare for the first time. And it is a really tough pill for doctors to swallow because it has been a physician-centric model for the last 50 years. It really has been. And so now we've been talking about having patient-centered care for a really long time, but it was still a very paternalistic model where it was like, well, we're going to help you, patient. And now patients are like, wait a second. And they are questioning things. And I actually think that's a really good thing. So I think the biggest misconception is that all the information out there on social media is misinformation. It's not, but you need to know how to find a trusted source. But you should absolutely, as a patient, as a smart consumer, be empowered and ask questions and show up at the doctor's office and say, hey, why am I being prescribed this? And what about this option? Would you prescribe it for me if it were covered by my insurance, but you're not because it's not covered? But is it a better option for me? Or what about these natural options? Why haven't we discussed any of these? Is it because you don't have enough time to talk to me? Ask away. And I think that my colleagues need to be more accepting of this. And I encourage all doctors, if you think there's too much misinformation out there, then get your butts on social media and do something about it and educate people and empower people and become the front line and reach more individuals with the right message and the right information.
So I'm guilty of doing something interesting. Went last evening while I was preparing for this podcast, and I asked ChatGPT, I said, what would Dr. Tania Elliott suggest in case I was drinking water in a sauna? And it literally told me she would say avoid drinking water while in the sauna because a slight level of dehydration stimulates erythropoietin erythropoietin, boosting red blood cell production and improving circulation and performance. So literally, it gave me something that I couldn't have imagined. It's literally speaking your language. So it's really getting your message across all over. The AI is getting so smart. It
Wow.
is unbelievable.
And listen, that was one of those controversial ones. I do think another thing is take everything with a grain of salt. And I do think actually this is another misconception. Like we live in this world of, either or, it's either this or that. No, there's a nuance in between. Like if you have issues with your blood pressure, I don't want you to pass out. And also, this is for people that are regular sauna users who want to maybe get a little bit more benefit. They're athletes, they're working out, and like I'm explaining the mechanism behind how a slight level of dehydration will then stimulate your kidneys to then produce more volume and more red blood cells. But it's like, don't take it for gospel either. And I think that's an important point. And we see it a lot with some controversial topics like Tylenol, don't take Tylenol. Tylenol is good, Tylenol is bad. Every single medication has a whole list of adverse events and warnings, and it's always a risk benefit conversation. And it's the same thing with vaccines, which we won't get into. It's a whole other topic, but like, it shouldn't be so polarized. It shouldn't be political. There's always something that we call a risk benefit ratio. And I think that that's something people need to understand. I blame the algorithm to some extent because it's like you see one thing, it thinks you like it, and so it feeds you more and more of that. So then you're like, this must be the right answer. And it's like, well, no, the algorithm was feeding you that. And if you had like gone another path, it would have fed you the complete opposite. But we really have to be careful not to be so polarized in healthcare.
So going a little bit controversial, what is your opinion on Tylenol? Because there is a huge controversy when the government came up and said that Tylenol is causing autism versus there's this big backlash of all the pharmaceuticals and even to some extent certain doctors and so-called learned people saying this is based in science. What is your opinion on it? Honest opinion on it.
Yeah, I think that we know that Tylenol can deplete glutathione stores. We know that medications could have adverse side effects. We know have we identified a causal relationship between Tylenol and autism, excluding every other factor? No, I don't think that there's a direct causal relationship. Is it possible that, right, we see this is how it starts, right? You see it in an observation studies, you're starting to see a correlation, then you dig a little bit deeper into the research. Is it possible that we might identify Tylenol to be a risk factor associated with the development of autism? Yeah, it's possible. So you know what? I am glad that at least we're having the conversation and that we're looking at it. I don't think that it makes sense for every person on the planet to be weighing in on it. I don't think that pregnant women should be sitting there taking Tylenol as an act of just like, this isn't true and I'm just going to shove a bunch of Tylenol down my throat. I mean, like that stuff's ridiculous, but like, there may be an association. And so the next step is to dig into the research a little bit further. And you know what? It takes time for us to figure this stuff out. It's just that now and medicine's one of the slowest things to evolve, develop a position around. So if anything, I hope that this could maybe speed up a little bit of the research that needs to be done. But
I
the
agree.
jury's out. The jury's out.
Absolutely. Absolutely. My next question would be, what is the most challenging part about being a public facing doctor? How do you deal with the critics, the internet trolls, or the pressure to be on all the time, especially in an industry where credibility is everything?
Yeah, I try not to even look at the comments. I must say I do look at views, so go ahead and follow me because I do like to see growth and I like to
Wow.
see my message reaching more people. So whatever you can do, Dr. Nanda, to help my growth, that'd be great. So I do
Absolutely.
find myself though getting a little bit depressed when I don't have growth. And that's really hard for me where I have to take a step back and say, okay, this doesn't say anything about me or about my content or that I'm a bad person. Maybe just the algorithm changed, but it's hard not to take it personally when you're not growing. So that's sort of my battle with it. And sometimes I have to say, like, I'm not going to look at my Instagram for a week because, like, it can't define my happiness, and I can't just like be getting dopamine hits from like having a viral post, you know? So that's one piece. I think the other challenge is making sure that you can create content that is engaging and is going to capture somebody's attention while not also falling prey to the hype or being fear mongering and things like that. So there's like this really fine balance with not having too much clickbait on your feed and making sure that you also have really good quality core content.
Truly, being a creator myself, I can understand, because if I put my heart and soul in videos and if it doesn't go X number, I feel like I've done something wrong.
Yeah, it feels terrible. You're like, my post did horrible. What was wrong? You overanalyze it. We blame ourselves. We're perfectionists. So
Absolutely. But let me tell you, so that you can be a little bit more relieved, I have a friend of mine who works for Meta, and I have a couple of friends really at very high positions on TikTok and a couple of friends in Google. And they all telling me that because of AI, what is happening is a lot more people are creating content and they're clogging the system. So let's say the eyeballs were 100 million and the content was 20 million. Now the content is 60 million and the eyeballs are the same. So it is messing up, and they are trying to see how they can have less AI and more genuine content like yourself. Next would be, when you are not on camera or in a clinic, what's the one unsexy, boring daily habit you practice that you feel has the most profound effect on your own health and peace of mind?
boy, okay, I'm going to give you two. One is right behind me. I don't know if you could see this, but this is moss art. And so I like to forage and find things and then put art together. And it's kind of boring. It's like pieces of moss, grass, sticks. You
Unbelievable.
create art from it. So that's one boring thing, but it's something I love to do. I also I started getting into crochet, which as we're getting into the winter months, I'm getting excited about doing that. I can't think of something more boring, but I like to do things that involve movement and keeping my hands occupied, and that's my form of meditation.
Beautiful.
So a lot of people can sit still and just meditate. I can't. So I like to dance, I like to move, I like to keep my hands occupied. And when I'm doing that and I'm occupied and I'm kind of moving energy throughout my body, that's actually my form of meditation. You see, I move my hands a lot too. So that's one thing. The second thing that I do is I love waking up early in the morning to the birds. So the minute I hear the birds chirping, I am in a good mood immediately. And there's some studies that show that the sound of chirping birds actually evolutionarily made humans feel safe, because when there's danger, birds were silent. I'm going to be doing a post on that, so you've heard it here first. But so I love hearing the birds in the morning. I pop up out of bed and I love to just sit and watch the sun come up. However, a new thing that I'm going to start implementing into my routine is making sure that I have exposure to very bright light within the first hour of waking up, because that is what gives you like a cortisol spike, which you want first thing in the morning, and then helps you wake up and have energy to start the day. And then it has a reciprocal relationship with melatonin. And so it actually properly sets your circadian rhythm so you sleep better.
Wow, amazing. So the next thing is, you're a huge proponent of telemedicine, as I can see. Means before 2020, I didn't even realize there is something really called telemedicine, and you've been doing it since 2013, you said. Amazing. Which is, you're basically leveraging technology to make healthcare more accessible. I hope more people follow your path. But you also talk about the importance of unplugging and doing a phone detox. How do you reconcile these two different philosophies? Because personally, I'll tell you something. I've been a big user of iPhone, and lately I've been having pain in my wrists, and I got a EMG done, and they found I'm developing carpal tunnel in my left side, and I am trying to detox from my phone. And I also saw some of your videos. I'm one of those guilty ones. If I've got to go to the restroom, I literally I get a mental block. I have to take my phone with me. And then since I watch your videos, I've bought a little infection control tissue, which I come and wipe my phone, but I'm trying to not take my phone into the toilet. Then I saw another video of yours where you're telling, don't sit more than 5 minutes or something like that. So, you know that I've actually done my research on you. So
Yeah, don't
how
sit
do
for
you
more than 5 minutes on the toilet, and I think one of the ways to not sit for more than 5 minutes is to not bring in your phone, because then you're either not gonna sit and be distracted, or you're gonna wanna get out and get back to your phone. So either way, it's good.
how are you reconciling? Because one side you're talking of unplugging and detox, phone detox, which is the most difficult thing for me right now. Also, and maybe probably 90% of my listeners, versus you're actually the foremost person. You're the internet Dr. Breathe Easy.
Yeah. Yeah, I think that they really are two separate things. I think it's like to ask somebody to take time off of work, especially if they are from lower socioeconomic status. You're asking them to take time off of work, maybe find childcare for their kids. Doctors' offices are only open from 9 to 5, and step away from all of that to go and have a doctor's visit, for them to say, okay, now I'm going to send you to go get a blood test. And then you got to go drive over to get the blood test. And now we're going to go send you to go pick up your prescriptions. You got to drive over to pick up your prescriptions. Okay, now we're going to have a follow up in a week. And now you have to what? Like, so I just think that that's ridiculous when you can take out your phone, click a button, and connect with a doctor in real time. And that's synchronous telemedicine. And then asynchronous telemedicine would be you fill out your symptom information, and then based off of that, a doctor reviews what you've written and then prescribes whatever it is that you need. So, and then between that and home pharmacy, drop shipping pharmacy delivery, at home blood pressure cuffs, now all of these new companies that have biomarker testing where they can either send someone to your house, or you can just go to a Quest or LabCorp, get 90 different biomarkers, get recommendations based off of that. Like, in my mind, the doctor's office is like how Blockbuster Video was. You remember Blockbuster Video? You used to have to go there to rent a movie. That was like, my Friday night with my friends when I was growing up. Um, it's just unnecessary. So I really do think the model of care is accessing your provider through technology, the consumer driving this healthcare and saying, listen, I know there's something going on. I want these 90 biomarkers. I want my preventive MRI study, and I have all that information and it's my data. And then I'm going to pick and choose which providers I interact with based off of what's going on with me. I think that's the future of care delivery. And then you still have the hospital setting and the radiology facility and the surgical facilities for when you need something hands-on. But I think the doctor's office needs to go away, and I think it will.
Is there any famous marker testing labs that will come to your home and actually do blood tests or do other tests that are required by your doctors to really evaluate you? Are there any famous ones that you trust?
I tried Function Health. I don't think there's anything too special about it. They send you to Quest or LabCorp, and you kind of get a full panel of tests that are run by Quest or LabCorp. You could even go online to quest.com or labcorp.com and pick whatever panels you want. They've got thyroid panels, heart function panels, hormone panels. So it's like you can literally go on there, and all of it is you order the test, and then there are doctors that are behind the scenes, telemedicine doctors behind the scene, that sign off on the blood test. They just review your results. I think any of those companies are fine, because at the end of the day, it's the same basic labs and it's the same providers behind the scenes reviewing the blood tests. But I do think, I don't want to say more is better, because like food sensitivity testing, for example, like there's no data to support that if you have a positive food sensitivity test, a positive IgG to a food, you should avoid that food, or that you're sensitive or allergic to that food. So some of them are rubbish. The problem is when you go to your traditional doctor, they are just skimming the surface with the most basic blood tests. So they're going to order maybe like 10 lab tests, whereas with, going on Quest or LabCorp or going on Function Health or one of these biomarker testing companies, they'll do 90. I think the real answer is probably like 40 or 50. But until traditional primary care doctors start like expanding their scope a little bit and ordering more tests, then I'd go for the 90. I did it myself. I identified I had a low ferritin level, and I ended up needing IV iron. My primary care doctor and my GYN completely missed it.
I agree with you. And that is something we need to propagate more. You need to propagate more, literally, because your voice is the voice of science. So the next thing would be, what is the biggest lesson you have learned about relationship between financial security and professional fulfillment. And did that change in your career redefine your own definition of success? Because most doctors, they are more focused on just going to the clinic, coming back, and then there's allegations they send tests to certain people, they send MRIs to certain people. How do you feel about this relationship between financial security and professional fulfillment?
Look, you know, I remember in medical school making decision. I really enjoyed family medicine and I really enjoyed psychiatry, but I was like, there's no way I'm going into those. I like pediatrics too. I'm not going into those fields. They don't make any money. Full stop. Right. And look where everybody, what they did. Everybody specialized. And the most popular subspecialties, dermatology, because of the great lifestyle and you make a lot of money, and GI. Tell me that there are like so many people raising their hands to be like, I want to do a colonoscopy every day and stick a tube up somebody's butt every single day. Like, come on. It is not the most, but you're dealing with poop. It is not the most like professionally fulfilling specialty. Now, granted, you want to be a hepatologist, I understand, but a lot of people went into procedure-based specialties for this very reason, because of higher reimbursement rates and because they had a ton of med school loans. I had hundreds of thousands of dollars of med school loans, and I wasn't going to be able to make that money back making $100,000 a year in primary care, even though I loved it. But that was the bottom line. And I guarantee you talk to a doctor, they want to be able to make money. Yes, we want to help people, but we also have a ton of med school loan to pay off. We're talking people having $500,000 in loans. Then it becomes a real challenge because they're burnt out. And if you look at the rates of physician burnout, they're through the roof. They're frustrated with insurance companies. They're frustrated that they're not getting the reimbursement rates that they wanted, because at the end of the day, they may love their patients, but they're like, I'm just sick of all of this and fighting for money and fighting for my ability to spend more time with patients. Advice I would give to doctors is, at this point, like, there are other options and opportunities and ways in which you can improve healthcare. Like, if you're passionate about a specific space, go find a startup that's doing something innovative in that space and offer your services as a medical director. If you're interested in AI, great. We need more doctors informing the AI models. Go and do that, And then when you're starting to do something that you're excited about and passionate about, that's when the money will come. And that's ultimately what I did. I started in private practice on Park Avenue, and I was like, forget this. Like, I don't care how much money you pay me. I am not going to be beholden to this messed up model. And then I just followed my passion and did what excited me and what I thought was going to really help patients. But I had to love what I was doing too.
Love your specialty. Practically, this is something that in today's world with ultra processed foods, immunity going down the drain, this is probably one of the best fields to be in. So, what's one piece of advice you would give to a younger Tanya, not about medicine or a technology, but about how to navigate the expectation of others and trust your own instincts?
Man, it's what I say to my kids every day. And it was something that I have to remind and say to my young self too, which is, you are so safe and you are so loved. And you really want to believe that and feel that you're safe and loved and held by this universe. And then from there, you can be more in tune with your body. Your nervous system is calm, and then you can trust your gut. The other thing is, and something I've had to learn is like the power of your intuition, because in medicine, I mean, you just are taught to completely separate from your feeling, from your emotion, from any form of intuition, from any sort of, you have to be incredibly stoic and just, you have to totally like be in your head and not in your heart and in your body. And I've had to unlearn that and actually feel back into my body and say, this opportunity feels right. This opportunity does not feel right. This relationship feels right. This relationship does not feel right. And really feel into that and trust my gut. I turned off my feelings, my emotion, my intuition for too long because I had to study, because I had to not have a sentiment or a feeling or an emotion when I was in front of a patient, because I had to get through 27 hours in the hospital, and I had to just be completely focused on whatever it was that I was, whatever code I was running, whatever I was trying to do. And now I'm much more in tune with my body and my intuition, and things like my Moss art help me get there even more, but it's so incredibly important.
Beautiful. Beautiful. And as a doctor and a mom, what is the one thing you do to protect your own health, mentally, physically, emotionally, that you wish more women would prioritize in their own lives?
You know what? I think that looking at their reflection in the mirror is really important, and they need to be able to recognize that face in the mirror. And at one point, I was so overworked, my hair was falling out, I was overweight, my skin was sallow, and I didn't recognize my face in the mirror. And it took me way too long to get help. But I would say that beauty is the first thing to fade when something is not going well in your system. And it's important to pay attention to those signs and not ignore them, not opt for just an aesthetic quick fix, but to say, like, I don't look right, I don't look well, and not just put that off to later, but say, like, how can I now prioritize myself? Because I'm seeing the look on my face and I'm not recognizing my reflection in the mirror.
So, words of wisdom here. Beauty is first thing to fade if you're not feeling well. Correct? Beautiful. So, guys, in case your beauty you feel is fading, you need to get your system fixed. So, I actually will ask you a few questions that are just general and that would be more in tune with what you do. So, maybe a lot of people have already followed you and watched you, but I see that thermal receipt paper video going viral all over. And then I also saw the plastic cutting board video. And then I also see you teaching about magnesium types and different things. And I also see about how to reduce gas versus even microplastics to avoid. What is the one wisdom tip that you would like to give to my listeners today?
Okay, well, here's one that just dawned on me yesterday. It's one thing I'm going to stop doing. I'll probably do a post about it, but I'm going to stop getting Chinese takeout food because when I yesterday ordered my food, it came in a black plastic container, and especially the food and the soups were so hot that the plastic, as I was holding the container, started to warp. So you can imagine what now has the microplastic concentration that has just gotten into my wonton soup, and then also those foods. I don't know how they're able to keep the food so hot and it's that hot by the time it arrives at my house. But if I want Chinese food, I'm going to start going to a restaurant.
What do you think when I order extra hot Starbucks at my Starbucks coffee shop? I always say I want regular whatever coffee, but I want it extra hot and I want extra hot milk poured on it or something. What do you think about that?
I think you should bring your own thermos.
I'm doing that next time for sure. For sure. Guy, thank you so much today. For guys who have not followed you, I'm sure everybody that I know probably follows you. But in case you have not, Dr. Tania Elliott is a voice to be reckoned with. Let people know where you are, where do you focus on, which platform do you focus most of your time. Tell anything. This is your shameless moment.
Well, thanks. Well, definitely follow me at Dr. Tania Elliott across platforms. Like, I can't even pronounce my name. Dr. Tania Elliott across platforms. Also, I just launched a Substack where I want to just try a different format. You know, I give these great 15, 30-second clips, but I want an opportunity for people to go a little bit deeper. So join my Substack, and it's called Real Health with Dr. Tania. And then give me ideas for things, topics that you want to learn more about. Where can we go a little deeper? Today, I just did a post about cortisol and the importance of having high cortisol first thing in the morning and how it actually helps you sleep better. So if there's a question that you have or a topic, we could get into it. We can even have a chat and interact on the subscriber chat. So I'm trying out that new platform. So come join me there as well. And let's see where we can take it.
Phenomenal. So follow Dr. Tania, come back. We'll keep bringing you more and more phenomenal people that are bridging the gap between science and sense. Thank you so much for watching.